We're not missing Lyme because it's uncommon. We're missing it because of how it presents and how inaccurate standard testing can be. I see this play out all the time. Patients with real symptoms but no clear explanation, both kids and adults who haven't found answers. And sometimes the real root cause is Lyme disease, but the reason it gets missed so often is because of how it actually behaves in the body. Lyme is known as the great mimicker because it doesn't stay in one lane. It can affect the nervous system, so it shows up as anxiety, mood changes, brain fog, even panic symptoms. It can affect the joints and the nerves, so now it looks like chronic joint pain and chronic nerve pain. Or with kids, we can see behavioral shifts, regressions, or pandas-like symptoms. And it can impact our immune system in a much deeper way than people realize. Lyme can dysregulate immune signaling, suppress things like natural killer cell activity, and even reactivate underlying infections that were previously quiet, like viruses or opportunistic organisms. So instead of one clear picture, you end up with multiple diagnoses that don't fully connect. Anxiety, fibromyalgia, chronic fatigue. And to be clear, those diagnoses are real, but at the end of the day, they're just describing symptoms and not actually identifying what's driving them. What I'm looking for is why the body is stuck in this pattern. And Lyme is one of the reasons I see come up again and again in complex cases. And then there's testing. Most conventional testing, like the Western blot, is looking for an antibody response, but that response can shift day to day depending on what the immune system is doing. I've seen patients that test negative on a Friday and positive on a Monday. So what often happens is Lyme gets tested once, it's negative, so now it's completely ruled out. But that doesn't always mean it's not there. It may have just been on that day the immune system wasn't mounting a strong enough response to actually detect it. Your body doesn't just make things up, and just because something hasn't been found yet doesn't mean that it's not there. You are allowed to keep looking, you're allowed to ask better questions, and you deserve a provider who won't just stop at the surface. So tell me, have you ever been given an answer about your health that doesn't fully explain how you're feeling?